Tonight in Healthy Living, knowledge is power, right? But it also takes work. Cincinnati Children's Hospital has a clinic that follows hundreds of children born into the opioid epidemic. The goal is for docs to study these toddlers and apply what they learn to the larger population. To that end, one of their findings published today.
You look good, my friend. You looks good, Daddy.
1-year-old Jayceon Hughes is doing well now, but he had an uphill battle from day one. His father, Reggie, says a mother's use
She was addicted to heroin.
means Jayceon was exposed to opioids in utero. He had something called neonatal abstinence syndrome, or NAS.
So those babies go through a process of withdrawal.
They're jittery, they often have GI upset, and a unique high-pitched cry.
I'm used to a regular baby cry, but it was a cry that it was like bloody murder cry. You know, you had to hold him.
To give Jayceon the best possible chance after his first days, Reggie brought him to the NAS follow-up clinic at Cincinnati Children's Hospital.
Little is known about long-term follow-ups of these babies, what happens when they're toddlers, what happens when they're school age. And our objective is to follow them out at least through toddlerhood and hopefully longer.
Following Jayceon led to a diagnosis of torticollis, a twist of the neck causing the baby's head to favor one side or another. It's often associated with a flattening of the head. If left untreated, it can cause longer-term issues.
In our population of kids with neonatal abstinence syndrome, 11% had torticollis. In previous published studies of the population incidence of torticollis, it's anywhere from 0.5% to maybe 2% of the population.
So 11% is significant.
Knowledge is power, right?
Yes.
And what does it allow you to do knowing this?
So for the kids that we have seen, we refer on to physical therapy.
That's exactly what happened with Jayceon, whose dad has high hopes for him and other children because of data collected in the clinic.
I hope that the next child that come through, they can see what they want to see faster.
That's the goal. The Cincinnati Children's study on torticollis published today in the Journal of Pediatrics. Doctors are also looking into things such as speech delays and school readiness, so checkups of patients like Jayceon continue. If you would like to learn more about neonatal abstinence syndrome, just look for this on WCPO.com, and we'll post links to some of my past stories.